All right, so please lie on your backs and find a comfortable position, either with your legs long or your knees bent, or possibly a pillow under your knees. Most of this lesson will be lying on our backs. Notice if you need something under your head, and preferably use a firm surface under your head rather than a pillow, if you have something available. Even a folded up towel sometimes is a little more firm than a soft pillow. And as you lie there, just begin to notice the symmetry or lack of symmetry of your spine. Feel the length of your spine from the base of your head, which would be the top of your neck, all the way down to the base of your sacrum or your tailbone. And just with your mind's eye, just follow the curve forward in your neck, the curving back towards the floor of your middle back, where the ribs are connected and you may feel contact there. The curve forward again of your lower back, and then the curving of your low back back to your sacrum, resting on the floor. And just have a sense of the length of your spine. Are there any places where it feels like your spine turns a little more to the left or to the right? Maybe you feel a little more weight behind your left or right shoulder, or the back of your ribs, or behind your pelvis and buttocks. And really give yourself permission to feel and appreciate the asymmetries. These asymmetries actually serve us in giving us something to notice. If everything was completely balanced and symmetrical, you actually wouldn't have something to notice in your physical experience to bring you into sensations. And those feelings and those sensations are the feelings that we can bring into our everyday life, rather than just the thinkings that we tend to bring into our everyday life. And very gently begin to roll your head a little bit left and right. And only go as far as is comfortable and easy. Can you notice the very first hint of effort? And just stop there. That's far enough, even if that only means rolling your head a half an inch to the side. Just feel the easy, gentle range of rolling your head left and right. And feel the line that you're drawing with the back of your head. If we had blotted the back of your head with ink, and as it rolled, it was drawing a line on the floor or on your pad. Just notice, again, is it a symmetrical line? Is it straight? For many of you, it might have a little arc to it. What's different on the left side than the right side? And as you gently rotate your head left and right, just have a sense of what the vertebrae in your neck feel like. Which ones feel like they're just naturally rolling with your head? And are there some that feel like they're staying, fairly in the middle? So some vertebrae are really designed for rotation, for the movement of turning, and other vertebrae are designed for other movements. So see if you can just get a sense of which ones just naturally turn with your head left and right. And for some of you, you may even be able to feel subtle shifting in your shoulders, your shoulder blades, your upper ribs as you turn your head left and right. Is there a connection as if the turning of the head is somehow talking to or influencing a little bit of movement in your shoulders and your upper back. And you may not feel anything at all, and that's fine too. And then just pause in the middle. And then one leg at a time, please bend your knees and put your feet flat on the floor. And begin to, in the same way you did with your head, just very gently rock your knees left and right. Really feeling for any sensations in your pelvis or your low back, going just as far as is easy and effortless, so that the action of bringing your knees back up to the center is just as easy as letting them drop to the side. Can you keep your abdomen soft when drawing your knees back up into the middle? So it's almost as if they're just floating left and right. And then again, as if we had blotted your sacrum and pelvis on an ink pad before you came down onto your mat, feel the line that the back of your pelvis is drawing on your pad. As you take your knees left and right, can you feel your pelvis just following along and the weight shifting behind your pelvis from left to right? Is it a straight line? Maybe it's a little longer on one side than the other. Your knees drop down a little further more easily. And again, there might be a little arc to the line that the back of your pelvis is making on your pad. There might even be places that are really smooth, and there might be places that are just a little not so smooth or a little bumpy. Just feel that in your system. Can it be okay that some places are smooth and some places are bumpy? Or is there an assumption that somehow the smooth places are good and the bumpy places are bad? And since most of you have never done this before, then the question might occur to you, where did you learn that in doing a movement like this, bumpy places might be bad? Or not going as far on one side might be wrong? If you happen to have the sort of mind that tells you those sorts of things. And then also, as you're taking your knees from side to side, feel how the weight shifts across the soles of your feet. So not only is the weight shifting on the back of your pelvis, but it's shifting left and right across each of your feet. And notice differences between how you sense that weight shifting through your right foot and your left foot. And it may be easy for some of you to notice that one foot feels very different than the other. Most people have a more dominant weight-bearing leg, and that's normal. And you can also bring your attention to the lower lumbar vertebrae that might be participating in this rotation. So your knees go from side to side and your pelvis shifts from side to side. But in order for your pelvis to shift, some of the lumbar vertebrae are also rotating, similarly to how the cervical, the neck vertebrae, were rotating with your head. So just see if you can get a sense of if that's easy for some of those vertebrae down there, or if some of them tend to hold you more in place and provide stabilization. Or maybe they're afraid to let you move. Various experiences you've had in the past, the muscles around those vertebrae may have learned to hold them in place, to not let them move. And then just pause in the middle. Let your legs down long if that's comfortable for you. And just feel your spine now. From the base of your head to the base of your tailbone, the whole length of your spine. How the weight of your trunk is resting on the floor, comparing along the right side to the left side. You're just noticing any small or big changes that have begun to occur just from paying attention and doing simple movements that bring your awareness to yourself. And again, please bend your knees up. Placing your feet on the floor. And this time, with your left hand, hold your right elbow, and with your right hand, hold on to your left elbow. Just kind of above the elbow, so it's a little bit on the upper arm and the elbow. And gently, with your left hand, just roll your right arm and your right shoulder towards the left. And with your right arm, roll your left arm and left shoulder to the right. So you're just rocking your shoulders from side to side. Letting your shoulders be as relaxed as possible, your ribs, your middle back. And again, feeling how one shoulder raises away from the floor and the other lowers down towards the floor. And that ink blot on the back of your middle back is now sort of creating some kind of a pressure design on the floor behind your shoulder blades, your ribs, your spine. Just feel how the weight shifts from right to left across your middle back. What's different when the weight is shifted behind the right shoulder than when it's shifted behind the left shoulder? Notice how you're breathing as you do this. As you bring your attention deeply to your feeling experience, does your breath stay full and relaxed, or do you begin to concentrate? And in some way, have you learned that concentration requires some sort of breath restriction? Does that become a habit for you? Is there any unnecessary tightening in your jaw or your tongue? Does your head want to naturally roll with your shoulders? Or is there a little bit of holding in your neck? Can you just let your neck soften, let your jaw and tongue soften, and just see if your head might roll just a little bit with your shoulders left and right, without you intentionally rolling your head, but that the rolling is a result of the rolling in the shoulders. Again, noticing which vertebrae in your middle spine rotate along with the rest of your trunk. can you feel your ribs rotating as your shoulders roll left and right? Can you feel anything happening in the ribs that are in front of you? The ribs that are also living along your sides, and the ribs in back of you, encompassing your lungs, your heart, some of your organs. And noticing also if you're doing anything with your abdomen or your pelvis, to either hold it in place or just allow it to participate in some small or large way with this movement. Did you automatically assume some kind of constraint, some kind of holding in your pelvis? And then just let the arms go. Let them rest long at your sides. And then bring your attention to your eyeballs. Big, round eyeballs resting in your eye sockets. And just see if you can feel how when you're lying on your back like this, how your eyeballs rest back into your eye sockets. How soft can your eyes be? And try a few times opening your eyes and picking a point on the ceiling to look at, and having a sense of if you can feel your eyeballs in your eye socket. And if that sensation is any different with your eyes opened and focused versus your eyelids closed and your eyeballs unfocused. Some people actually maintain a certain level of constant tension in their eyes and the muscles around their eyes. So even with their eyelids closed, there's a focusing effort happening. It's like people who keep their teeth clenched or their mouth tightly pursed. It's not necessary, but somewhere along the line they learned that habit. And then either eyes opened or closed, begin rolling your eyeballs right and left in your sockets. And see if as you move your eyes from left to right, if you can just sense how those eyeballs really roll in the socket. And you might feel some places where it really doesn't just roll smoothly. It's like a marble that's had a few little chips taken out of it, so it kind of bumps along. You might find that rolling your eyes in one direction is very smooth, but rolling them in the other direction is a little rougher, a little more bumpy. And again, only roll them as far right and left as feels really easy, really comfortable. You might not go to the full range of motion, looking out the side of your eyes. You might just roll them just gently right and left. Feeling the amount of effort in the muscles around our eyes is likely not something you've done often, if ever. So it's worth being curious about and playing with at various times outside of this lesson. And also play a little bit with rolling your eyes from right to left with your eyelids open and closed, and just noticing any differences in that. And can you feel anything else wanting to roll? Is there anything about taking your eyes from side to side that begins to invite your head or your neck or your jaw or anything else? Can you feel anything else just very subtly wanting to orient with the eyes? And if so, just kind of let that happen. Try not to resist what's naturally there, but that you may have learned not to integrate with that movement. And then just rest your eyes. Feel the eyes resting back in the sockets, unfocused. And then please bring your attention to your lower jaw, your lower teeth. And in the same fashion we've done the other movements from left to right, just very gently glide your lower jaw left and right, just as far as is easy and comfortable. If you have any history of TMJ problems, be conscientious of this. You're not doing this lesson to please me, the teacher. You're doing this to learn how to be curious, interested, and to bring a new kind of awareness into your life so that life becomes about intentional choices instead of habitual patterns. And again, what else is invited to move with the jaw? As you glide your jaw left and right, is there anything else, your eyes, your head, your chest, anything where you feel an inkling of invitation to go left and right because the muscles of the jaw are being organized to glide left and right? Noticing also the smooth spots, the rough spots. What's the trajectory? Is it a straight line that your jaw goes left and right? Or maybe you notice that it arches a little forward towards the ceiling, or backwards towards your throat at certain points. And then let that rest. Let your legs rest. Let your arms rest. And once again, bend your knees up, please. And just a couple of times, go through each of these parts and play individually or together with them going left and right in the same direction. Knees, shoulders, jaw, eyes, head. You might just try each of them singularly. You might combine a couple of them. But again, bring as much awareness to how your whole body is organizing around the side-to-side movement, the rotation, being initiated by part or parts of your body. Notice the support that the floor gives you as you shift your weight in various ways, left and right. You can almost imagine the floor massaging the back side of you as the front of you rotates left and right. And then come to the middle and rest. And begin rolling your head and your knees in opposite direction of each other. So your head and nose go to the right gently and easily, and your knees turn to the left gently and easily. And just feel the twist that that creates in your spine. Have a sense if that feels congruent or incongruent. For some people, that twist actually feels most natural, most normal for the organization in their system. And for others, it feels like it's in opposition. And notice what your eyes are doing. Do your eyes just naturally follow your head to the left and to the right? And what if you were to take your eyes in the same direction as your knees? So as your head goes left, your eyes and your knees would go to the right. And as your head goes to the right, your eyes and your knees go to the left. And you breathe and keep your jaw soft. And as soon as you create an organization in that starts to become easy, can you also feel the impressions now that the back side of you is making into your mat? Or is it just enough? Is it enough to wrap your brain around the differences in the head and the eyes and the knees? And then rest in the middle. And now hold on to your elbows and begin taking your elbows gently right and left. So your shoulders are rolling, your middle back is rolling. And just notice what's natural for you. Is it more natural to let your head and your knees go in the same direction subtly with the elbows? Or do you tend to naturally create movement in opposition to that? And just sort of feel how that is for you. I see both happening in the room. So all possibilities are available. And then if you're not already doing so, what if you intentionally take your knees and your head in the opposite direction of your elbows? So as your right arm pulls your left arm to the right, and your middle trunk rolls to the right, you turn your head and your knees to the left. And as your right arm pulls your left arm to the right, your head and your eyes go to the left. Can this become easy and effortless? Can you feel your spine turning and twisting from the base of your head to the base of your tailbone? It's okay if the answer is no. And if the answer is yes, can you feel the impressions that the back of your trunk is making in the floor with this differentiation of movement, taking movements in opposite directions of what feels like the normal organization of the system. In the Feldenkrais method, we call it differentiation. It's wonderful to introduce an organized chaos into a system, because the system will then create more balance and more organization in a new way than how the mind has constructed it from old habits and patterns. And then rest in the middle again. Bring your attention to your eyes and your jaw. Can you take both your eyes and your lower jaw in the same direction a few times, right and left together? Can you feel an invitation for your head then to also turn right and left as your eyes turn right, as your jaw glides right, and as your eyes and jaw glide to the left? Notice the rhythm of your breathing. So everything going right and left, pick just one to go the opposite direction. So you've got head, eyes, and jaw. So you might keep your eyes and your jaw going to the right, but turn your head to the left. It's one experiment. Do listen to yourself. For a very few people, this can create a kind of nausea in their system because it challenges those old patterns. So listen for that and be more gentle. Do less. Do less. Or you could take your jaw and your head in the same direction, but your eyes in a different direction. Or you could take your head and your jaw in the same direction and your eyes in the opposite direction. Or maybe you can't, but you could play with the idea of the possibility. And as you play with these, notice the rhythm of your breathing, or lack of. Possible to differentiate these movements that are intimately connected, the most primitive movements that you did in utero even, is turning your head, your mouth, your eyes to basic survival, to find your source of food, to organize towards your mother's breast for food and nourishment and comfort. And rest in the middle. Maybe a couple times just let everything roll left and right together without thinking too much about it. Just being, just feeling the softness. And then again, bend your knees up if they're not bent up already. Hold onto your elbows. And just begin taking your knees and your elbows in opposite directions. And make an intention with your jaw to go the same direction as your knees. And this might be just a very subtle movement. It's very likely that the jaw movement is not perceptible from anybody who might be looking at you. You might just move it just a fraction, just that sense of intention of the opposite direction. Be very gentle and easy. And notice, is the inclination for your head to stay in the middle? To slightly roll in the direction of your jaw? Or to want to roll in the direction of your arms? Or none of the above? And is it possible to take your knees and your jaw to the left, your head and your elbows to the right, while breathing and being gentle, playful, just being easy with this? And then a few times take everything together, to the left and to the right. Head, eyes, jaw, elbows, knees. And toes. Knees and toes. Sorry. Everything together. And then pick just one. Eyes, jaw, head, elbows, knees. Pick just one to take in the opposite direction. And if you picked one and it came reasonably effortlessly for you, pick another one to add to it. If not, just stay with the one, maybe pick a different one, maybe switch to a different opposite. Or you can add two opposites. And then a few more times, just let everything roll together. Let it all go. Roll everything to the left and everything to the right. Just 2, maybe 3 times. And then just let it all go. Let your legs down long. Let your arms go. Give your weight fully to the floor, to the invitation of gravity that is always here, holding you on this earth. Just rest now on your back, arms to your side, legs down long if you're able to. And feel your spine now. Has anything changed in how you perceive the sensations of your back resting on the mat? The length, the shape, the size of your spine, connected to the base of your head, arching away from the floor, connecting back into contact through your middle back, and each of those vertebrae that supports one of the ribs. Arcing again gently away from the floor in your lower back. And then feeling the back of your sacrum in contact. And then again, like we did in the beginning, just gently roll your head 1 or 2 times to the left and to the right, feeling for that first perception of effort or resistance, and just noticing if the sensations have changed, if they're different, if the organization feels different in some way now. And rest in the middle. And imagine what kind of physical activities, sports, or daily things that you do in life is good differentiation useful for? Just think of 1 or 2 or 3. Does anything come to mind? And then take your time to roll to either side. Come up to sitting and then standing. And stay in this place of sensation. Stay in feeling, how do I feel my embodiment now? What is percolating in me to attend to feel? And just linger there. Notice if the mind wants to linger in new and pleasant sensations, or if it's looking for old and uncomfortable sensations. And just remind yourself that's just a habit, looking for what used to be there, and just let that go and feel what's new, feel what's alive.